We're now ready to look at the peripheral nervous system. Once you've completed this section, you should be able to describe the anatomy of a nerve, compare and contrast the somatic and autonomic nervous systems, compare and contrast the sympathetic and parasympathetic nervous systems, and list and briefly describe homeostatic imbalances of the peripheral nervous system. Just as a reminder, in the peripheral nervous system, parallel bundles of neuronal processes, that is, those myelinated axons, are referred to as nerves. We call them tracts in the central nervous system. Now, nerves, because they're outside the central nervous system and the peripheral nervous system, need some extra support, so they have several different types of connective tissue that help strengthen them: the epineurium, the perineurium, and the endoneurium. Also, within the nerve, there's an arrangement of bundles of nerves that are called fascicles. So that when we look at a cross-section of a nerve, we have the individual axon with its myelin sheath, and each one of those is surrounded by the endoneurium. This is connective tissue. Then we have the nerves bundled into arrangements called fascicles, and each fascicle is surrounded by another connective tissue sheath called the perimysium. Then the whole thing is wrapped up in epineurium, another connective tissue sheath. And notice that some blood vessels travel in the nerve, because remember, nerves need lots and lots of oxygen and nutrients, and so we bundle some blood vessels in there to make sure they have a good, rich blood supply. Afferent nerves are the sensory nerves. Sensory nerves, remember, are input, and some nerves in the peripheral nervous system are strictly sensory. Efferent or motor nerves are going to be composed only of motor fibers, and motor fibers are carrying information away from the central nervous system. But most peripheral nerves are mixed nerves, that is, both sensory and motor fibers travel together in the same nerve. The peripheral nervous system can be divided into the somatic system, which is your conscious and voluntary system, and there will be somatic sensory nerves and somatic motor nerves. We'll know the somatic motor nerves because they're going to go to skeletal muscle. Or we have the autonomic system. Now, the autonomic system is your unconscious, involuntary system. You cannot consciously control anything that this system does. Again, we'll have autonomic sensory fibers and autonomic motor fibers. And the autonomic system goes to the internal organs, the viscera, to the glands, and to the heart. Both autonomic and somatic systems have sensory neurons, they have motor neurons, and they will travel together in the same nerve. Peripheral nerves can be divided into the cranial nerves, the ones that come directly off the brain, and the spinal nerves, the ones that come directly off the spinal cord. There are 12 pairs of cranial nerves, and for the most part they go to muscles and organs in the head and neck region, serving the muscles, the facial muscles, the tongue, the taste buds, the eye, hearing for the ear, those kinds of things. There is one nerve, the vagus nerve, that leaves the head region. It has fibers that extend down into the organs of the thoracic and abdominal cavities. Since this nerve is going to visceral organs, this means that this nerve has primarily an autonomic nervous system function. Most of the rest of the cranial nerves have a somatic function. You are conscious of taste, for example. You actually hear things. You see things. Some of these nerves are purely sensory, like the optic nerve from the eye or the acoustic nerve from the ear, and some of them are purely motor, like the spinal accessory, which goes to the muscles of the neck. But most of them are mixed, having some sensory fibers and some motor fibers. The spinal nerves are formed when the ventral and dorsal roots of from the spinal cord merge. There are 31 pairs of spinal nerves that come off of the spinal cord. These are all mixed nerves. They have both sensory and motor fibers in them. They have somatic and autonomic fibers in them. Just to show you how long a nerve can be, the sciatic nerve, which comes here off the lower back, is the longest nerve in the body. It comes down, Comes down the thigh, the back of the leg. You can see it here coming down the thigh and the back of the leg. Makes a turn and it goes under the foot all the way to the big toe. The spinal nerves do something interesting. Rather than coming straight off and one nerve going to one location, the nerves interweave. That's what plexus means, weaving. So that fibers from several spinal nerves intermingle to form new nerves that have names. Now this is the brachial plexus, and nerves from C4 and C5, C6, C7, C8, and T1 all come off of the spinal cord. But then they start to merge and intermingle, and separate nerves come off of the other side. Things like the radial nerve, the ulnar nerve, the musculocutaneous nerve, to mention a few of them. Any one of these nerves that come off of the plexus will have some fibers from more than one spinal nerve. They'll be intermingled. Some of the plexuses are the cervical plexus, which is an intermingling of the nerves C1 through C5. These nerves tend to go to the head and the neck. An important nerve here is the phrenic nerve, which actually goes to the diaphragm, which controls breathing. That's why neck injuries sometimes end up with people having difficulty breathing. The brachial plexus is probably the largest and most complex of the plexuses. It's an interweaving of the nerves C5 through C8 and T1. These are the nerves that go down the arm. A nerve that you can relate to is the ulnar nerve. This nerve goes right across the olecranon process in your elbow. When you hit your elbow just right, you send that tingling, lightning-like feeling through your arm to your hand. That's because you've hit your ulnar nerve, which is exposed right there at the elbow. The lumbar plexus is an interweaving of nerves L1 through L4. These form the nerves that go to the hip and thigh, like the femoral nerve comes out of the lumbar plexus. And then the sacral plexus has a little bit of overlap with the lumbar plexus because some of the L4 nerves are involved here. So nerves from L4 and L5, as well as the first four sacral nerves, interweave to make the nerves that come out of this plexus. And this is the plexus that the sciatic nerve comes out of. The autonomic nervous system is your involuntary system going to smooth muscle, cardiac muscle, and glands. So if it's a smooth muscle, the heart, or a gland is involved, then it's sensory or motor fibers that are part of the autonomic nervous system. Besides the effectors, there are a couple of other differences between the autonomic and the somatic nervous system. The autonomic nervous system has two motor neurons that travel to the effector. There's one that goes from the spinal cord to a cluster of cell bodies, a ganglion, and that's the preganglionic nerve. And then from the ganglion to the effector is the postganglionic nerve. In the somatic nervous system, acetylcholine is the only neurotransmitter that's used, but in the autonomic nervous system, acetylcholine and norepinephrine are both used as neurotransmitters. Now, norepinephrine is chemically related to adrenaline. So just a little breakdown here. The somatic nervous system has that one motor neuron, releases acetylcholine as its neurotransmitter, and its effector is skeletal muscle. This is conscious level kinds of stuff. The autonomic nervous system has the preganglionic and the postganglionic motor nerve. It's going to release acetylcholine and norepinephrine, and it's going to go to smooth muscle, glandular tissue, or the heart. The autonomic nervous system is also divided into two divisions, the sympathetic system and the parasympathetic system. The parasympathetic division is the housekeeping division, sometimes called the D system because it takes care of digestion, defecation, and diuresis. It's the feed and breed system. In order to procreate, in order to eat and digest food well, you have to have your parasympathetic system in charge. This one takes care of maintaining a normal heart rate, normal respiratory rate, and normal digestive activity. The other part of the autonomic nervous system is the sympathetic division. This is your fight or flight system, sometimes called the E system because it kicks in any kind of stressful situation like exercise, excitement, emergency, even embarrassment. This one causes the heart rate to increase. It increases blood pressure and respiratory rate. It will slow digestive system activity. In terms of the developmental aspects of the nervous system, any part of the nervous system can be damaged during pregnancy or at birth. Things that are ingested by the mother can damage the developing nervous system. Mothers that drink excessive alcohol, for example, give rise to children with damaged nervous systems. Women that have measles while they're pregnant, the measles virus may attack the nervous system of the fetus, causing damage there. Cerebral palsy is one of the things that can happen to a person at or near birth. It's a neuromuscular disability, usually because there was a lack of oxygen sometime around the birth event. The nervous system requires a lot of oxygen, so any deprivation of oxygen tends to damage some part of it. There are other causes for cerebral palsy, but lack of oxygen is probably the most common cause. People with cerebral palsy have poor muscle coordination. They may have seizures. They may have mental retardation. Anencephaly is another problem that's a developmental problem. For some reason, the cerebrum fails to form. Since the cerebrum is the conscious part of the brain, they have no control of their motor function, nor do they have any sensory function. Nothing conscious happens. But the lower parts of the brain, the unconscious parts of the brain, develop, so they have a heart rate and a respiratory rate and all of those things. Spina bifida is a condition that occurs when the vertebral foramen does not form properly. All of the bones do not form around that little circle that the spinal cord goes down. This tends to happen particularly in the lumbar region. Now, you may have one little piece of bone missing out of one vertebra and there's no real pathology. It doesn't cause a problem. But if several vertebrae are affected, then you can get this meningocele. And basically, because there's no support there of the lumbar vertebra, the dura mater can bulge out, cerebrospinal fluid can collect, and that's going to put pressure on the nerves that are in this region. Since those nerves go to the leg, these people have paraplegia. When they grow up, they don't have big legs. Their legs are very small and underdeveloped. There's no muscular development since those muscles never really got any stimulation. They also have an inability to control their bowels or bladder because the autonomic nerves that come off of this region would also be damaged, and they go to those internal organs. There are a lot of things that happen to the nervous system starting from birth and going on to old age. Your brain is pretty well developed when you're born, but the hypothalamus is the last part of the brain to mature. Now, the hypothalamus has all of those homeostatic control mechanisms, including your thermostat, so that temperature regulation in babies may not be fully developed. Newborns are typically put in incubators for a short period of time at least until they can verify that they're capable of holding normal body temperature. Neurons quickly become amitotic, that is, they lose their ability to divide. So when you damage a neuron, it's dead. There is no cell division that's going to replace that one. Myelination is also not complete at birth. Very few of the nerves are myelinated. And as nerves become myelinated, you get more control over those nerves. Now, myelination goes from anterior to posterior, top to bottom. So babies can lift their heads long before they can move their feet to walk. And it goes medial to lateral, so they get control of gross movements of the arms, so they can wave bye-bye, long before they can use their fingers to pick up small objects. So you may think that that's a practice thing that they're doing, but actually you've got to have myelination of the nerves before they can develop those skills. Your brain is at its maximum weight in young adulthood. That's about 25. After that, it's a steady decline in weight and mass. Not a good thing to know, is it? Neurons will die over the course of your life and become damaged. Remember, there are no replacements. We don't go through cell division to make more. You do come with a few more neurons than you really need. But as you damage neurons, you pull from that pool, and over the course of time, they also die natural death, so you diminish those in number. You do continue to make new neural pathways. That is, you can connect the neurons you have in all kinds of different ways, so you continue to learn. You can learn up until the day that you die. The sympathetic nervous system tends to become less responsive as you get older, so that your ability to deal with stress diminishes slightly. Now, on a day-to-day basis, this can show up as something called orthostatic hypotension. Hypotension is low blood pressure, and orthostatic means position. If you recline or if you sit for a long period of time, your blood kind of pools in the lower limbs of your body, in your legs. When you stand up, your sympathetic nervous system is supposed to take that minor stressor, cause the blood vessels in your legs to constrict. Those smooth muscles in those blood vessels will contract, and that's going to force blood quickly up through your body to make sure we maintain a good blood supply to your brain, because if you don't have a lot of blood going to your brain, not enough oxygen, the brain cells sort of shut down temporarily, and you may faint. Well, as you get older, when you stand up suddenly from a seated position or get up too suddenly from lying down, your sympathetic nervous system doesn't kick in as soon as it should. So you don't get that very quick response to constrict the blood vessel. And for a few moments after you do this, after you stand up, you may feel a little lightheaded. You may even get dizzy. Some people go so far as to pass out, but usually it's just a little lightheadedness. The older you get, the worse this gets. So you need to keep that in mind when you're dealing with elderly people as you have them sit up or stand from either lying down or sitting down, to give them a few moments to transition. Do that kind of slowly, and then be aware that they may be a little dizzy for a few moments after doing that, simply because blood is not getting to their brain as fast as it should. Arteriosclerosis is a hardening of the arteries, sometimes due to plaque buildup in the arteries, but it does cause poor circulation. And again, that can mean that blood is not flowing freely to the brain. The brain's getting a little less oxygen, a few fewer nutrients, and so brain cells can begin to deteriorate. In extreme cases, this can lead to senility, as a number of brain cells are affected. However, it's more likely to lead to a stroke, a cerebrovascular accident. The plaques inside the blood vessels are more likely to cause the development of clots, and those clots can get into some of the small blood vessels of the brain, cutting off a blood supply to a part of the brain. Brain shrinkage occurs. This is accelerated in alcoholics and in boxers. Alcohol is very damaging to neural tissue, so people who drink a lot tend to kill off more brain cells faster, having fewer left at the end of their life. And boxers get a lot of head injuries. And anyone who's had a lot of head injuries may suffer from a more accelerated brain shrinkage, simply because that trauma will also damage brain cells. All right, let's see how much you've learned. The division of the peripheral nervous system responsible for taking messages to the central nervous system is the motor division, sympathetic division, autonomic division, or sensory division. Remember, input is always sensory information. Output is motor information. The sympathetic system is the fight or flight system that's part of the autonomic division. The division commonly referred to as the fight or flight system is the, okay, this is tricky, see if you can remember this, it's been a few minutes since we talked about it, somatic division, central division, sensory division, or sympathetic division. That's right, the sympathetic system is your fight or flight system. The outermost connective tissue covering of a nerve is the epineurium, perineurium, endoneurium, or fascicle. It's the epineurium. The perineurium is the covering of the fascicles, which are subdivisions of the nerve, and the endoneurium is the connective tissue covering around each individual nerve fiber. The condition of the nervous system caused by incomplete formation of the vertebrae is cerebral palsy, hydrocephalus, spina bifida, or anencephaly. Spina bifida, that's the one where you can get the meningocele. Cerebral palsy is some sort of damage to the brain sometime around birth, just prior to birth, during birth, or after, usually because of oxygen supply. Hydrocephalus is when you have an overproduction of cerebrospinal fluid that puts pressure on the brain, and anencephaly is a failure of the conscious part of the brain to develop.